Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, welcome to this episode of Anti-Aging Insights. As always, it's wonderful to have you along. This is another episode in my continuation of the facial muscles, working our way from the top to the bottom with regards to what you can use neuromodulator to treat and how you can use that in a way that you can improve your expression, improve your appearance, if that's what you choose to do. Today, we are talking about the Platysma. Now, before we get to that, I do want to tell you a little bit about something new that's coming on my Instagram account, but I'm going to save that to the end. So if you're interested in possibly being featured on my Instagram account, then stay tuned and we'll talk about that a little bit at the end. Now, like I said, today we're talking about the Platysma muscle, and we are going to talk a little bit about the anatomy of the muscle, what it is, what it does, and then we're going to talk a little bit about neuromodulator treatments and how you can treat the Platysma to get certain effects with regards to your face. Now, before we get into the Platysma, I also want to remind you that over the last couple of months now, I have been taking this journey from the top to the bottom. So we've talked about the frontalis muscle, the muscle in the forehead. We've talked about the procerus muscle and the corrugator muscles, the muscles that cause the frown lines between your eyebrows. We've talked about the DAO. We've talked about the mentalis. We've talked about all kinds of muscles in the face. So if you haven't listened to those episodes and you're interested, then please feel free to go back and have a listen to those prior episodes. Today, we are talking about the Platysma, as I said. So let's get into that. First of all, what is the Platysma? Where does it sit? What is the anatomy? Well, the Platysma is a sheet of muscle that lies along the front and sides of your neck. It basically extends from the top of your pec muscles, your pectoralis muscles, and extends up as a sheet and eventually attaches to the jaw, the mandible. Why is this important? Well, the Platysma has a couple of functions. The one that's most relevant to the aesthetics industry is that the Platysma, when it contracts, it pulls down slightly on all of the muscles in the face. So you can think that when one wants to have a facelift, which of course is a surgical procedure, there are other more subtle options. Now, you're not going to get as dramatic effects, of course, as if you were to have surgery. But because the Platysma is pulling down on some of the muscles in the face, particularly the lower muscles, if you relax that muscle, the Platysma, then you do not get that downward pull on those muscles. And essentially, this results in a slightly increase in the uplift of the muscles. Think of it this way. When you're pulling down less on the muscles, what happens? Well, the relaxing state of those muscles is that it tends to be a little bit higher. And so this is a very subtle, but subtle way that you can get a non-surgical facelift. Now, the other way that the Platysma is very common to be treated with neuromodulator is for bands of Platysma that runs down the front of the neck. So typically you'll see a nice smooth Platysma, but sometimes you can see bands that run down either side of the neck. The best way to bring these out, if you want to see them, is to actually just make the sound E. And when you do that, and you hold that E, if you're watching this on my YouTube channel or on Instagram, you will see that when I do that E sound, I get about 4 different bands. I'm getting 1 on each side of my neck and 2 that are closer to the center. I'll do that one more time. E. And these bands can sometimes be unattractive to some people. Sometimes it gets the name of having a turkey neck. And the good news is that if you want to treat that, you can actually treat that with neuromodulator. Now, I didn't say this at the outset, but just to be clear, when I say neuromodulator, I'm talking about the different types of drugs, such as Botox, Nuceiva, Xeomin, Dysport. They're all considered neuromodulators. And again, the way they work is when you inject a neuromodulator, it prevents the nerve in the muscle from communicating as easily. That, as a result, prevents the muscle from contracting as easily. And when the muscle doesn't contract, well, then you get less of the overlying wrinkles that would otherwise be showing up in the skin with the movement of that muscle contraction, which we have now reduced. So that is the key way that works. Again, we inject neuromodulators such as Botox. It relaxes the muscle. You get less contraction of the muscle. You get less wrinkles. Or in the case of the Platysma, you get less of those bands. And if you inject in certain cases, in certain places, then you get a little bit of that lift. So let me go over some of the anatomical locations now of where I would inject. If you just want to deal with those platysmal bands, as I described, then it's quite simple. We target those bands. I would ask you to make that E sound, and while you are doing that, I would inject along the band in a couple of different places. Usually 6 or so injections, roughly, give or take, along each band. Of course, I would do an individual assessment when I saw you, but it would be a couple of units of the neuromodulator in a couple different places along each of the bands. If you decided to have the treatment done along the line of the jaw in order to increase some of that lift, then that's actually got a specific name. That's a Nefertiti lift. And that is done with a number of injections in a couple of different points along the jawline, throughout the front, and along the other side of the jawline. It's a very quick procedure, whether you're just treating the bands or whether you're treating the jawline as well. It takes a few seconds and relatively comfortable. The needles that we use are extremely small. They're basically like insulin needles, tiny, tiny little needles, and that's it. You would come in, I would do an assessment, check the muscles out, see where we need to inject, come up with a plan, come up with a dosing, completely individualized to you, and then we would inject them. And as always, neuromodulator takes a few days for it to kick in, with about a week to 10 days for it to have its full effect, and then it would wear off again in approximately 3 to 4 months. So that is essentially how the neuromodulator works for treating the platysmal bands and for doing a Nefertiti lift. And if that interests you, then of course, as always, feel free to reach out to me at antiagingvancouver.com, drterifisher.com, or on my Instagram at drterifisher. Now, as I hinted at the beginning of the episode, I want to also just tell you about a new feature that I'm doing on my Instagram channel. And that is featuring before and after pictures with my clients, you, as the feature. Now, before and afters are done very commonly. They're very important because I know people like to see the work of an aesthetic practitioner. But I've been thinking about how I can make it even more patient-centered. In healthcare, if you're a healthcare provider, then you know that we talk about patient-centered care, where we really try to put the focus on the patient and really treat the patient in all aspects from their perspective. And I was thinking, when we do before and after pictures, yes, it highlights a patient, but the goal of that is really to showcase the practitioner's skills. That is true. I'm not going to lie. That is true. That is a lot of what the before and afters are done for. But I thought it would be really nice to feature the client and put the emphasis on the client by essentially presenting these before and after pictures as small pieces of art. And you will see in my Instagram account that I've now presented them as such, as small pieces of art. And the part that's really fun for me and for the client, if the client wants to be part of that, is to actually come up with a name for that piece of art. So you'll see that the first one is up there. It's a lip before and after, and it's called Lip Loveliness because I think it really captures the vibe of what we were trying to achieve with that particular patient. This particular person wanted to have a very natural, subtle, not over the top lip volume enhancement. She wanted to have essentially lovely lips, and that's why we called it Lip Loveliness. And so I hope that you'll enjoy the way that I'm presenting those. If you want to be a part of this particular before and after art collection, then reach out to me and we can always even decide on the name of the art together if it is you that we are featuring. Of course, this is always with permission of my clients and my patients, and it's just another really fun way that I can put the emphasis on you and really feature you and your face as the canvas that we use to come up with this art. Okay, so there you go. I hope you have enjoyed this episode, a little bit about the Platysma, a little bit about this new campaign that I'm doing, and as always, feel free to reach out if you feel the need to do so. I would be delighted to hear from you. So thanks again for tuning in this week. I look forward to chatting with you again next week. Stay tuned for a lot of new stuff that I'll be announcing over the next little while. I'm really excited about 2024. And as always, be well. I'll talk to you soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.